Hello and welcome to At the Heart of Health with Dr. James Marcum. In today's well-marketed world, it's hard to know who or even what to believe when it comes to health care. In each program, Dr. Marcum, a board-certified behavioral cardiologist, takes a balanced approach using common sense modern medicine and the ultimate source of truth, the Bible, recognizing that at the heart of health is love.
I'm Dr. James Marcum, and welcome to Heart of Health. You're probably wondering why you're watching a health show. Hopefully you chose to watch this, or you just weren't channel searching or browsing when you could be watching this instead of a Western or some great mystery or some exciting sports event. Well, I think we've got some valuable information just for you. I want to wake you up. I hope you don't have sleep apnea. We have Dr. Chandra with us, and last week we started exploring this condition that's underdiagnosed and it's killing millions of people if we don't treat it correctly. Well, millions might be an over-exaggeration, wouldn't you say, Dr. Chandra?
It's not actually.
Okay.
Yeah, it's at least 24 million, if not more, Jim, so you're right on target.
Now, you're a specialist in sleep apnea. What got you into this healing ministry of treating sleep apnea, getting at the core of these problems?
Because I was seeing in my daily practice that we were missing out on sleep, and it was impacting so many other organs. And here was a disease which was still undertreated, unrecognized, or under-recognized, and I found that I could really make a huge difference. It was preventative medicine at its best. You can treat people with air and oxygen and actually reduce stroke risk, improve their blood pressure, improve their quality of life. So I think it's just a great field.
Now, do you have to have specialized training in sleep apnea? It seems like it's a new field that's sort of grown the last 10 years.
Yes, absolutely. And, there is a fellowship now, and you're right, till recently there were no fellowships. So people had to, go to whichever institution and get training and, more exposure. But now there are a lot of training programs, which do offer, higher training in this.
Now, do sleep specialists like yourself do this full-time, or is it just sort of a part-time thing that you sort of dabble in?
A lot of us who were not doing it full-time have actually gravitated towards doing it full-time. And more people are just specializing only in this field.
Wow, that's exciting. Well, that's what we're going to talk to, and we're going to talk about a lot of questions and answer from our listeners. But before we start, we defined last week what sleep apnea is. For our viewers that might not have seen you last week, what is sleep apnea?
Sleep apnea literally means pauses in breathing during sleep. And it usually presents with a person snoring, or having gasping respirations, interrupted sleep, and also presenting with daytime fatigue and tiredness. And, people may not have all these symptoms, but just some of these are a combination of these.
Now, of all the professions you see, is there any professions that are more likely to get this sleep apnea?
Truck drivers are up there because we know, poor dietary habits, poor sleep hygiene and long hours of work. All this predisposes them to much higher, prevalence of sleep apnea.
Now, we talked in the last program about the different symptoms. Can you go over those again, the symptoms, and what that might lead you to as far as the testing?
Yes. Jim, as I mentioned earlier, the most common symptom is snoring, being tired in the daytime. There's a whole bunch of other symptoms which people can present with. Just, waking up frequently at night and getting up to use their bathroom frequently, waking up with headaches in the morning, dry mouth in the morning, just nighttime heartburn, which is not being treated, blood pressure, which is running high for no rhyme or reason. Suddenly you develop high blood pressure, you're a snorer, you wake up tired, and depression's also been linked, symptoms of depression. So it's a whole spectrum.
And when those symptoms come, that's going to lead you to sleep apnea testing.
Yes.
And what's that briefly entail?
The gold standard is the sleep study, Jim, and that involves that people go to the sleep testing center and spend the night over there, where we record several different organ systems, including brain waves, heart rhythm, oxygen in the blood, leg movements, you know, so all this, and we put this all together in order to make a diagnosis.
And then once you make that diagnosis, you can tailor the treatment.
Absolutely.
Now, does insurance pay for these type of testing?
Yes, most of the insurances do pay for the testing.
Well, that's good. We have lots of questions that's come to us, and after our break, we're going to talk about whether what causes sleep apnea in the first place. We'll be right back after this brief break, and we're going to answer your questions regarding sleep apnea with Dr. Chandra. I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
Two words for you. Pop quiz. Ready? Name any funny movie. A drama. Name a mystery. And one more thing. Name the movie your kids saw today in science class.
Know what really matters. Know about your kid's school. And know about your kid. Find out 100 ways to know more, do more.
I'm Dr. James Marcum. If you're just joining us, we're talking about sleep apnea, this tragic problem that's overcoming America. We're talking with sleep specialist Dr. Chandra. And I'm going to go to the questions now that have come into Heartwise Ministries. And one of these questions that came in, it says, what causes sleep apnea in the first place? Where does it start?
Yeah. Jim, the big problem, the main problem, believe it or not, is at the oropharynx. It's your airways, the soft, floppy part of the airway right here. And this tends to occlude and close up intermittently in people with sleep apnea or obstructive sleep apnea. And, you know, as you mentioned earlier, as we get heavier as a population, our collar sizes increase. That does occlude the airway even more, more and more. But there are other predisposing characteristics. People, who don't necessarily, they're not heavy set, but they can have a narrow jaw or enlarged tonsils, low-lying soft palate. Anything which narrows the upper airway is going to predispose a person to developing sleep apnea.
Now, they've diagnosed as sleep apnea. This is what causes it, the airway obstruction. How do you get oxygen through an airway that's obstructed?
And it's difficult. So that's the reason the treatment which we have, which is the gold standard, is continuous positive airway pressure, or CPAP.
Okay.
And it's a little mask that you wear which either covers the nose and the lips. And there is a little machine which sits on the bedside which generates pressure, air at higher pressure, pumps it through the upper airway, acts as a splint, and keeps the airway open through the night.
Now, is it comfortable or uncomfortable? I've heard several people say that it just doesn't feel good on them.
Right, and that's one of the big stumbling blocks in the treatment of sleep apnea. But over the years, this has improved significantly, even though it's still not perfect. But given time and commitment on the part of the patient, it's something that people can get used to it. And it has huge benefits in terms of reducing your stroke risk, improving blood pressure, quality of life. So, initially, like anything else, it takes a little getting used to. But, the benefits absolutely are just astounding.
Yeah. I have a patient I want to ask you about. He came to the office just today, and he had a heart attack not too long ago, subsequently had bypass. He has terrible sleep apnea. In fact, when I did the heart catheterization, the angiogram, he quit breathing for so long, thought I might have to breathe for him. His saturations went down in the 60s. Just scared me just doing the heart catheterization. Well, he has sleep apnea, and he comes in today, he says, I just cannot keep my mask on, no matter what I do. And I know what this is doing to his chemistry. It's raising his adrenaline levels, blood pressure, he's gonna have atherosclerosis, more problems, because we haven't really got at the cause of his heart disease even.
Right.
Is there anything that you can think of that might give me something to tell him to make this more doable?
Right. And first of all, we need to really focus in on trying to see what the problem is. Was it the mask itself, where the pressure is too high? It's a whole art. It's a science, but it's also an art. And then we also offer our patients other options like surgical treatments, which are there. And there's also oral appliances, which is like a mouth guard, which can be made by the dentist and which props the airway up some. Both of these treatments, are second line compared to the CPAP, which works the most effectively. But there's still an option which need to be discussed, especially for somebody, who's having such a lot of difficulty in using the CPAP.
Yeah, because this is a life-threatening problem that people have when they don't get any oxygen. The bells and whistles go off. It's stressing the body quite a bit.
Yes, absolutely.
Let's go to, this is a good question here. It's sort of a humorous question, I think. This is from a wife that says, my husband has sleep apnea. Is this contagious? She wants to know if you can catch sleep apnea.
Well, it's not contagious, but it can be inherited.
Oh, really?
Absolutely. And they're working at finding several genes which contribute or which lead to sleep apnea. So we do see that it runs in families. We know that certain ethnic groups, including Asian Indians, Chinese Americans, also African Americans, have a much higher prevalence rate.
This is an interesting topic. This is such a, we talk about how we have such a health dilemma. We're spending so much money on treating symptoms now that are many preventable, and it sounds like sleep apnea might be one of those. Now, I have a question for you. We screen for things like diabetes. We screen for things like high blood pressure. We screen for cholesterol because there's such health risks. Do you ever see in the future that even though there's not a symptom, that we might screen for sleep apnea?
There is a questionnaire called the Epworth Sleepiness Scale. And basically this is, it's got several questions about how sleepy a person is. The patient fills it out themselves, and it has been validated over many different studies. So we know it correlates well with a sleep problem. So, and it's a simple questionnaire, unlike a blood test or, any other invasive test, which tells us a lot. And it's available, on the internet. It's available, at several, most of the sleep centers will have this.
Because many doctors still don't screen for this. They screen for diabetes, they screen for these other things, but this might be a larger health issue, and it's important that the patients take health into their own hand.
You're exactly right. This is a problem which is of public health, and it's got huge consequences for the community and for society at large.
Well, Dr. Chandra, this is a fascinating and yet important for our health dilemma. It's important that we answer these. We're going to talk a little bit about how we can get more information when we come back after break. Friends, if you want more information on this program or get questions to Dr. Chandra, go to our website. That's heartwiseministries.org, and we'll be right back.